Hello, everyone, and welcome to a panel discussion on caregiving and COVID-19 as part of today's WALK program. Thanks for being a part of WALK today. My name is Wyatt, and I am a consultant in palliative and residential care for CaringKind. We hope that the discussion will be helpful in our roles as caregivers. And let me start with some introductions. First, we have Carol Levine, who is a senior fellow at United Hospital Fund. Carol, you want to wave? Adina Siegel, who is a Jewish community outreach social worker at CaringKind. You want to wave? Great. Dr. Moverine Beverly is president of Moverine Beverly PLLC and a patient engagement and cultural competence specialist. And Anna Hall is the Chief Purpose Officer for Connected Living.
Hi.
Thank you so much, everyone, for being here today and participating. We hardly have to tell the average caregiver about what isolation means, because if you're a caregiver, you've already had a lot of experience with that. And sadly, COVID-19 has made that a lot more complicated. So that's why we really wanted to focus on this a little bit. And first, just talk about, from each of you, if you could talk a little bit about something that is of particular note to you related to these last few months and caregiving. And then we will move on to some practical suggestions to try to be helpful to caregivers as we face the months ahead. So Anna, how about, would you mind starting?
Sure. So I work at Connected Living, which is a company that serves senior living communities and also, older adults, caregivers, families in the community. And what we've seen globally is, as you said, a massive increase in isolation, which leads to, I think, more caregiver stress. And also the person who's living with dementia, it can be just a strange, confusing time when things are changing and it's hard to explain how, what these changes are for and what they look like. And so we've seen a surge in desire for meaningful engagement in new ways because the old ways aren't as effective. And we're also seeing a bright side here in that the ability to integrate technology into the care partnering experience can be a great help, not only during COVID, but beyond.
Thank you. Dr. Beverly?
Yes, no doubt these are just very difficult times for everyone. And I thought I would introduce a topic of the common thread, the human experience, particularly in the time of COVID. What do I mean by that? So the common thread is that once accurately diagnosed, there is no one on planet Earth that can give it back. So a billionaire can't say, I'll give you $1 million to take the cancer back. Or that's not enough, I'll give you $5 million. And the reason I make that point is that maybe if we understand and accept the common thread, we could be more empathetic about the fact that this particular major lack of choice in one's life and can be extremely detrimental. So with that backdrop, in terms of the patient engagement, particularly during these difficult times, I would recommend for caregivers, when there's communication with your loved ones, with healthcare professionals, be it doctors, nurses in nursing home staff, nursing home staff, health aides, you want to make sure that the individuals, the clinical teams or the professionals that you're communicating with know who your loved one is, who is the individual. Not who is the patient per se, but who is the individual, because the patient is not the sum total of the individual. The individual is much more complex human being. And so you want to be able to identify, and let them know who your loved one, who is the person, who is the individual. And again, because of in this COVID environment that we're in, what is the fears? The things that we may be afraid of now is not what we were afraid of pre-pandemic. And so we need to be able to understand and explain that to not only our family members, but also to caregivers in the professional field as well. And we also need to communicate what's important to the individual. I think that's a really key item, because if you don't know what's important to me, then how can you help me? And also, where is the individual or the family members is in the acceptance of the disease? And why is that important? Because different individuals accept diagnosis at different points in time. And so if there's a conversation that could be held that would explain and better serve the person with this newly diagnosed, the disease, be it dementia or be it cancer, we want to be able to understand the time frame that it takes and be a little patient if possible. If not, but be able to provide information that would actually speed up the acceptance of the disease. So in closing, communication is key. Make sure that they see who you are, not who they perceive you to be. Because the perception of who I am and who I actually am, you could see how it could affect my care and my caregivers around me. And with better communication, it will cause a better collaboration and understanding, as I said, of who the individual is, and lead to potentially better health outcomes. The other thing I would recommend is when a caregiver or a family member goes to a nursing home or a hospital, ask about what's in my family member's social history. Because the social history should define who you are. Are you married, single, separated, divorced? Are you retired, school teacher, retired postal worker? What is your religion? And as opposed to it just saying no toxic substance. Okay, because I think because medical students, interns, resident, doctors, nurses, everybody look at the social history. So if the social history doesn't help to define who you are, then you see how that could be a problem. So that's what I would highly recommend. Ask, what is in my social history? And the whole idea is communication, and to know who I am as an individual, not who you perceive me to be.
Thank you. Carol?
I come at this issue from the perspective of a former family caregiver, not for a person with dementia, but for a person, my late husband, with a serious traumatic brain injury. So it's not all that different. When I think of what people are going through now with COVID, I think it's adding a tremendous pressure on an already probably minimally stable situation, so that what is the backdrop is normal in the sense that most people would think, but it's caregiving always in a crisis or always with uncertainty. And then adding not only the uncertainty of what is happening to me and to the person I'm caring for, but what is happening in the world. I think it adds to the isolation, not only in feeling alone in your personal life and personal situation, but isolated in the sense of not really being connected to what's going on. And I think it's also important that we think about and we talk about caregivers and persons who have dementia or another disease, but there are all sorts of other family members, all sorts of other situations. There are children, there are young adults, there are people who've lost their jobs or have been furloughed. There are people who have all sorts of other issues that are calling on the caregivers resources in the sense of time and emotional listening, and that can be extremely demanding, even though it is also a way to stay connected. So I think what I've been doing lately is listening in on a number of groups that have been talking about this very subject. And they all start, as Anne did, with isolation and loneliness. And then they start talking about money, and they start talking about jobs, and they start talking about kids going back to school. And so it's seeing the totality of the issue is really important. So it is, you can drill down on one piece of it, but you really need to see the whole experience.
Thank you, Carol. It certainly is huge.
Yes, huge. Yes.
Adina.
Well, first, I mean, I concur with like everything everybody said. It definitely resonates with my experience. I mean, isolation is a huge thing when we're talking about it. When I think about the experiences that I've been dealing with for the last 6-7-ish months or so, actually at the walk, I think it will be 8 months. I think the other piece to isolation is also the lack of resources. And whatever caregivers were holding on to, whatever thread of support they had, whether it's their home health aide or their support groups or the social adult day program, suddenly that all changed. It's kind of gotten well, with home health aides, at least I now have people who are taking, who have home health aides who've resumed or they've been able to find replacements. But particularly in the beginning, it was really difficult for people. Social adult day programs are still closed. And I think I got a lot of calls from people who were discussing how the person with dementia is completely disoriented because their whole schedule is shot. They have nothing to engage with, and they've actually declined. Plus, on the caregiver side of things, there's no respite anymore. So, I've seen, and I guess as a CaringKind social worker, you're kind of working with both ends. You're working with the lack of physical resources, and then you're also dealing with the emotional components of isolation, of not really having people understand, or everybody's so busy with their own problems, they're not going to have the time to listen to somebody who's dealing with a loved one who has dementia, or anybody's is, if it's a different type of relationship, that if somebody has dementia and there's a care partner involved, it's a really very difficult and challenging situation at this point.
Well, now, I think, we've certainly, I think, identified what we all know to be true about caregiving, and how much more difficult it is these days. And maybe now we could work a little bit on some practical suggestions that we're aware of, that we've either encountered through people we know or situations we know or in our own experience. And do you want to start, Hannah?
Oh, yes, sure.
Sorry.
So I'm going to say something that's very practical and a little bit obvious, but it's kind of a new spin on an old technology. So we've been talking about how important it is to know the person-centered care, right? To know who is this individual, not just as a patient, but as a person. And then also the importance of support from the family, from the community. And one of the ways that we can achieve that when we can't see people in person is to use technology. Some of the benefits of technology are that communication and support can take place in non-real time. So for example, a caregiver might need to have some words of assurance or some advice or some tips, or to know that the whole family is involved. It's just not on that one person's shoulders, although the brunt of it often is. But being able to bring the family together, either virtually or through an app, as Connected Living offers, has given some real relief to people. You know, it's a little thing, but it's a big thing in this environment. So for example, Connected Living has a mobile application that is created specifically to bring families together. And when you think about, you know, someone on the panel mentioned that some of people living with dementia are not as engaged because they don't have the resources that they used to be able to go to, like an adult day center with programming. Through the mobile app, family members can contribute videos, music, messages, and this can help supplement what the caregiver who's there in person is able to provide. We have also recently partnered with a robotics company to bring the first personal robot to market. And this robot's called Temi, and he, she, it has Alexa built in and can move around. So it brings FaceTime really to a whole nother level, makes it seem more real, it's more interactive. And the family members or caregivers from a distance can interact with the robot, remote control it, and feel as if they are in the room with their family members and their loved ones. Using Alexa skills, simple things like, I'm not gonna say it because my device will go off, but turn off the light, right? Can be when it's across the room and you're in the middle of personal care, or turn on the light, or do, you know, simple commands like that, or ask a question or play some music, can be a huge relief in that moment. So again, it's not the solution, but technology and robotics and mobile applications can play a great role in supporting individuals, increasing ways of being engaged in personally meaningful ways, and bringing families together.
Thank you. Dr. Beverly?
Well, that was really innovative. I agree totally. All the pieces fit together. So knowing the individual and technology could really combining the both could really change how we respond to the current circumstances, COVID. I think one of the things that I'm not quite sure how to decide or how to fix it, particularly with telehealth, could be a helpful hint. If a caregiver thinks that the family member is suffering from depression, and how we bring that to the forefront of the conversation. And so I think communicating the change in behavior for that individual would be important by contacting the primary care physicians and to see if there is a mental health individual or psychologist that would interact and take a history from that individual to make sure that the diagnosis is correct, and how do we end up treating that person. Because that's what I've heard from certain friends of mine, that they really think that their mom is depressed and never had that issue before. And so how do we recognize that and solve that problem? So I think communication with primary care physicians with that information and a referral to mental health specialists might be helpful, particularly, and again, I go back to, you know, what are the patient fears? What's the individual fears? Because if you're fearful of something, then you could be very depressed about the circumstances. So that information needs to be shared. So that would be my recommendation. And that would maybe the interactive robot could be an asset in that area.
Yes.
Yeah.
Yes. And the robot does telehealth, but it feels more like a personal interaction.
Yes, and absolutely.
Thank you. Carol?
Well, I will give just a few examples from my life, which is because in some ways, I still think of myself as a caregiver. I have found, and I've been retired, so-called, for a year now. And so part of getting able to manage my life in these new circumstances has been a challenge for me, because I never know what day it is. I'm not sure what I'm supposed to be doing. I check my computer all the time. I think it's important for caregivers and for the person they're caring for to establish a new routine so that what has been lost has been the predictability of certain times we do this, we do that, and the person gets used to that routine, and it may be different now, but it's important in my view to establish a new way of dealing with the day, getting dressed at the same time, having meals at the same time. I think that helps a lot. For the caregiver, and maybe for the person, I don't know, depends on their health and situation. I've found that, and I'm not an exercise person, I have been doing yoga by virtual yoga. And every time it's time to do it, I say, oh no, I don't want to do this. And then when I do it, I feel so much better. So any kind of physical exercise, even if it's a walk, maybe you can take a walk with the person, maybe you can't. Maybe you can do something that you used to do, really does take your body out of your head and focus on that. So that's been, I think that's always a good thing to do. And yes, keeping in touch with family and friends is really important. In my family, my 3 children and I have a weekly Zoom call, and they're in different places, and it's really been quite remarkable how much closer we've all got. And we're not dealing, yes, my eldest daughter is dealing with a seriously disabled child, and so that's been a problem. But just having her hear from her siblings has been great. So whatever you can do to use technology or plain old phone and plain old TV is very helpful, I think.
Yeah, bringing a little bit of predictability back into
Yes.
wide open,
Yes.
unlimited circumstance.
Yes.
Great. Adina.
So I've kind of brainstormed a bunch of different things. I have to echo, I may echo a lot of what Carol was saying. I am a big fan. I mean, I definitely second keeping up a routine, getting dressed in the morning and trying to do this, as much as you can, in not maybe in not the same way, in a predictable way. I think Zoom is a really wonderful tool. Assuming that the person with dementia can engage with it. There are virtual programs that can be used. On our website, on CaringKind's website, we have videos of different activities you can actually do to engage with somebody with dementia. They are interesting, they're fun, and they really can make a person feel very useful. I think that's another thing. You're kind of just loafing around the house. You don't really know what you're supposed to be doing. And particularly people with dementia, they can start building up a lot of agitation just because it's like, well, there's no rhyme or reason to anything in this existence of COVID. And it can be really hard for many of them to really understand it. So if you say, just one example of one of those videos, you give them the silverware drawer to reorder. It gives them something to do. They're contributing to the house. And so that's something that can be engaging. Let's say if they find that Zoom just can't grab their attention. I also second the idea of keeping up social ties. I actually had somebody who called me a while back who was caring for her husband, and her husband was also completely out of sorts because his social adult day program closed. And I was trying to explore, similar to Dr. Beverly was talking about what that person's interests were, what his background was, and he actually really liked art. And so I said, you know what, why not make cards for people in the family and send them out? And then he can both do an art project and you're engaging with your family members. So that really was helpful. I think it really is about being creative or trying to think about, well, what was working before and how can we sort of try to repackage it in this current situation. I was also thinking about a couple of like practical things for caregivers to know about with COVID, particularly when it comes to supports like a home health aide or well, social adult day programs are closed, but or nursing homes or things like that, because those can be really tricky right now. It is really important to ask what the protocols are, say for a home health aide. A home care agency should tell you what their protocols are. You want to ask if they provide PPE. You want to make sure that your aide uses PPE and practices social distancing practices. Hand washing at regular intervals for 20 seconds, singing happy birthday, all of that. That's very important. You also might want to check the aide's temperature beforehand. And if they have temperature, don't let them in the house. And I believe temperature is 100.4, but honestly, if it were me, I don't know if I would be okay with 100.0, but I'll leave that for the medical professionals. You also want to just also, if you know that if an aide or any other person has been exposed to COVID, obviously you also do not want them, to be coming into the home as well. It's sort of similar. I have sort of similar suggestions for people with nursing homes. I actually didn't touch on nursing homes in my previous piece, but that's another consideration that is important, because we do get a lot of calls from people who have relatives in nursing homes with dementia, and it is really hard for them because a lot of times they either can't visit, they can only do phone, they can do phone or tablet, FaceTiming, which works for some people. For others, they find it really disorienting. Some nursing homes allow window visits, which also can be really disorienting. I think obviously you do want to make sure that your nursing home is utilizing proper protocols around COVID, which is probably not that difficult to find out given the Department of Health regulations. But I think what's also really important is the social component of things, and trying to make sure that there are things that a loved one can recognize in a nursing home, like old pictures or maybe old, like a blanket or a quilt that they really liked, or something tactile that will remind them of home, to maybe try to give them some familiarity when they can't see you as a caregiver. I'm trying to think if there's anything else. And then just for the caregivers themselves, I think that it's also really important. I think, honestly, not too much of what I'm advising has changed. I think it's really important to reach out and seek help and ask for help. That's why we have CaringKind to, provide assistance and emotional support for people, and they should be calling our helpline if they do need support. I also think that taking breaks is important, even if it's just 2 minutes just to do some deep breathing. If that's all a caregiver can muster, is also important, because a caregiver needs to have that time to at least sort of replenish, as best they can. And if, assuming that a caregiver does have home help, then I think also really important to take that time and to utilize it for your own self-care.
Well, that's a very good note to end on. I want to thank all of you very much. I think that our purpose here today was to connect with caregivers and express certainly our concern for them, and also that we understand about isolation. We understand, how hard this is for people. I do want to underscore the value of predictability, of bringing a little bit of routine into the day, because I think that's good for both caregivers and for the person with dementia. Not a rigid day, but some ability to predict the day gives you a little bit of yourself back, I think. So for more information or help with caregiving, obviously you can certainly call CaringKind's helpline. And I want to thank our panelists, Anna Hall, Dr. Beverly, Carol Levine and Adina Siegel. We were very grateful that you were able to join us today. Thank you all very much.
Thank you.